próxima sessão intitula-se Supporting Sustainability Implementation do IHF, Geneva Sustainability Center. Vamos convidar para subir ao palco o moderador desta sessão, Leandro, membro da direção da APAH, e também a oradora Sylvia Basterrechea, da International Hospital Federation.
Muito boa tarde a todos. Quero, antes de mais, cumprimentar todos os presentes, aqui fisicamente e também àqueles que estão virtualmente. Eu tenho a honra e o prazer de apresentar aqui e moderar aqui esta pequena sessão com Sylvia Basterrechea. Sylvia é formada em Saúde Global e Ciências Sociais. É, desde há 4 anos, uma das pessoas que tem acompanhado o International Hospital Federation em alguns projetos, nomeadamente no Young Executive Leaders Program, que eu tive o gosto de acompanhar e, portanto, a Sylvia já não é alguém novo para mim, mas que vão também perceber que tem muito a oferecer-nos e muito a partilhar. A Sylvia está, desde há relativamente pouco tempo, no IHF Geneva Sustainability Center, que é um centro da International Hospital Federation e que foi desenvolvido no sentido de trabalhar esta temática para aquilo que são os profissionais da gestão em saúde e tentar ajudá-los a ter capacidade para poder fazer melhor o seu trabalho de uma forma mais sustentável. Esta sessão é subordinada ao tema Supporting Sustainability Implementation e eu vou passar a palavra à Sylvia. So, Sylvia, thank you very much for your presence and take the floor, please.
Thank you very much, Leandro. It's the first time I'm being introduced in Portuguese and it sounds lovely. Also my first time in Portugal, so all the more very happy to be here. So thank you to APAH for the invitation, and thank you also for recognizing this important topic and making sure that everybody can be aware and have the good tools in hand to do things as good as possible. So today I'm going to talk to you. I'm not going so much to teach you about the problem or topic. I'm going to try to give you some practical examples and solutions that we are going to try to provide internationally. So I'm going to talk about this Geneva Sustainability Center, which was created in 2022, so this year, by the International Hospital Federation, based really on the need and the increasing voices about the importance of placing this topic on the international hospital agenda. So just a little bit of background about the International Hospital Federation. Some of you may be familiar with it already. It's a membership organization working internationally, and the goal of the IHF is to provide a platform for knowledge exchange. You can see here a sample of the logo of the organizations that we have in the membership. You can see a nice Portuguese representation, including the organizers of this conference. And the goal, as I mentioned, is to connect the hospitals worldwide. So we have ministries of health, national associations of hospitals, and also professional associations. The IHF was established in 1929, so it gave some time to establish a big network and to connect hospitals and really reflect on what are the good practices and what are the important topics to talk about as decided by the membership. We noticed that one topic was increasingly important and demanded in the past years, and this is really the issue of the role of the hospital sector in climate change and their responsibility to face it. One of the ways we saw that this was happening through a lot of case studies and examples and voices and discussions that we had with the members, which I'm going to talk a little bit about later on. So I don't think I have to repeat what the problem is and the fact that there is this contradiction that hospitals are actually contributing to a problem that makes people ill. But I want to talk more about the opportunities that everybody has to drive the change. We at the IHF focus mainly on the issues related to management and leadership, and so this is really what we are interested in when it comes to the opportunities that people can have at every level of the organization. So really what can be done in terms of the direct impact and the internal practices of the hospital, clinical practices and so on, but also the supply chain and everything that goes before and after the operations of the hospital, and also the role of hospitals to advocate in the broader communities for more sustainability. So I mentioned that we saw there was a growing awareness and a growing demand to talk about it within the membership. An example of how we saw this is through the IHF Awards. We have 7 categories, and one of them is around green hospitals. And this year we received close to 50 entries from 21 countries, and this is a number that tripled since last year, and we can expect that in the future years we'll have an increasing number of good practices being shared. I just wanted to mention that in the 10 finalists this year we have hospitals from Portugal, so congratulations, and we can see here really with their example that various things can be done also in terms of clinical practices, and the results will be announced at the World Hospital Congress in 3 weeks. So the International Hospital Federation wanted to react to that issue, like I mentioned, and do more than just include it in their activities and their daily activities. So the Geneva Sustainability Center was created for that purpose and to really fill the gap of connecting hospitals, but also raising the awareness that people may not hear enough about in their daily lives. So it's an organization that was created. There's an executive director leading the center. She's Sonia Rochnik, who is an internationally recognized expert on the topic and has dedicated her whole professional career to that issue. We are currently a team of 3, we'll be a team of 5 before the end of the year, and are really currently working on getting the feedback of everybody to know what is really necessary for you, what are your needs, and how can we help best supporting you, basically. So our mission is really to support hospitals to become leaders for sustainability in their communities. And how do we want to do that? We want to do this by supporting you and equipping hospital leaders with the information, tools, skills, trainings, and so on to deliver a net positive impact. I also want to mention that it's a great added value to have the International Hospital Federations network, because it means that we don't only speak with those who are already aware and already doing something, which is often an issue with the organizations working on environmental sustainability, but we also can talk with all those who think it's not a priority or they don't have the resources, and we can really try to provide solutions tailored to everybody's situation. We also use a holistic approach to sustainability because we are aware that to deeply decarbonize healthcare and try to reach this net zero healthcare, there are a lot of different paths that can be taken, a lot of different approaches in terms of the ways to go there, the bottom-up approach rather than top-down approach, if it's an initiative that would come from the staff or even the patients expecting more sustainability from the healthcare providers. We know also that there isn't sustainability without equity, and that everybody has to be accountable when it comes to implementing practices related to sustainability. So that also includes the leadership levels, the board, and the employees. So with this slide, I really just want to emphasize that we know there are a lot of different ways. It's not an easy solution. It's not a 6-month process. It's a long-term process and a long-term commitment. And there are a lot of different ways to get there according to everybody's budget, their setting, their main priorities, and so on. I did mention that we had several examples already across the membership to show that there are solutions and that there is a positive impact. So here I'll take 2 examples, quite different, and there are a lot of others, but let's focus on 2 for now. Here is the example of Kaiser Permanente, a major health system in the US. They had their main issue was to face wildfires And during wildfires in California, they had power shutdowns. So they wanted to reduce the emissions that they were using during times of shutdown, as they were mainly using diesel generators. But they also wanted to adapt to be more resilient, so to prevent any problems when a new climate hazard event would occur. They implemented, in partnership with the state, a sustainable local electrical grid, and that one of the benefits and of the impact was to have more storage, which is very important in terms of backup power when it comes to the operations of the hospital, because not enough power means reducing the operation, which can result in delaying patient care, which we do not want. So this was one of the benefits of that specific case from Kaiser Permanente. And another interesting result was to know that there was savings in terms of energy, in terms of financial savings, which is also always good to take when you have to convince your board that something has to be done. And there was also reduction in terms of carbon emissions. So this is one among many other examples that, as I mentioned, is quite ambitious because of the partnership with the state and quite a big logistics and political will behind it. So I'll also talk about the second case study, which comes from the UK in this NHS trust. And their goal was to reduce the energy consumption and the cost of their energy consumption. So to do this, they decided to really play on the daily habits of the staff and see how this, through behavioral change approaches, could result in reducing the energy consumption and cost. So to do that and really enhance or make sure that the staff would be engaged, they combined the argument of energy saving with improving patient experience. And this resulted also in financial savings. They also were able to identify other ways to save energy and money. And here you have very small examples of practices that can be done on a daily activity, such as closing doors or turning off side room lights and get good energy savings as a result. And they were happy to see that there was also an improvement in terms of patient experience with reduction of noise disturbance and improved privacy. So those are two examples among many others. And this is something that we are currently doing with the Geneva Sustainability Center, is really collecting all those experience throughout the membership of the IHF to make sure that not only those case studies are being showcased and that good practices are being exported, but also for everybody who doesn't know about those type of practices and can maybe identify themselves, see that a hospital in another country has a similar number of beds, a similar setting, a similar budget, and can be connected with them to really see how they can work together. So this is a lot of the things that we will be working on as we develop our activities and our portfolio of activities, in the goal to really build awareness, make sure people know about it and know especially about what they can do to improve the situation. So we want to promote the action quite urgently. And also we want to equip the hospital executives with the right tools and develop the leadership. So I'll go through some of the activities that we're currently in the process of developing. So I didn't mention already sharing what is already out there, so sharing not only the case studies of what is happening across the world, but also some important resources which are related to healthcare and climate change. And in the result also promote collective action. So connecting people together, but also letting you know if there are funding opportunities, if there is a bid for projects that you can take part in, and so on. We also are developing this maturity diagnostic, as we call it for now, which is an online platform that every hospital can go through in order to identify what stage they're at, which level they're at. Because like I mentioned before, and you're all very aware of this, not everybody is at the same stage, not everybody has even started, and we really want to recognize the diversity of what can be done, but also of the situation of everybody. So we really like, this motto of thinking that anybody or any hospital can at least do something. If they're already doing something, they can do more, and if they're already doing something great, they can always do better. So this maturity diagnostic would help any hospital identifying where they're at and which tool they can use afterwards as a result. This will be available before the end of the year, by the way. We also, in terms of leadership development, developing some master classes that can then be tailored to any setting or any audience. So in 3 weeks at the World Hospital Congress, we'll have the first masterclass preview. We'll have about 22 hospital CEOs from about 20 countries taking part in that masterclass. So we'll be able to see first reactions, what should be edited, what should be changed. And we are planning to conduct various masterclasses next year according to the need, to the demand, but also through the partners and being able to, again, raise the awareness and give the right tools to act. We are also working on leadership competencies for sustainable healthcare. So at the IHF we already have a framework of competencies, of core competency for healthcare managers, and we are from there creating a model which will include also the core competencies for any executive that want to drive sustainable healthcare. We are going to work in partnership with various organizations, so organizations that already work on the topic of healthcare and climate change, but also organizations that are well established internationally that may not have this as a sole focus, but so we can make sure that it is integrated increasingly and internationally in the conception of healthcare, that sustainability should be an integral part of healthcare. And finally, I've mentioned it already a few times, we have the World Hospital Congress, which is the annual conference of the International Hospital Federation. And it will take place in Dubai in 3 weeks, and I know I'll see many of you there, so I look forward to it. The theme is around sustainable healthcare, so we talk about the workforce, the ways to deliver care, and also those different green hospital initiatives. And this for the Geneva Sustainability Center, which is still pretty new, is going to be an amazing point of contact to see a little bit what is the awareness so far, what are the needs, how we can help, and really gather a lot of feedback and be in this listening mode. We are also trying in a more practical way to make Congress more sustainable, also to be relevant and just implement it also elsewhere than just in the healthcare sector. So we are doing a few things in Dubai, although Dubai is not the easiest place to do this, but we have very high hopes for next year's conference to make a really good event in terms of sustainability, but also in terms of the content that we'll provide and the information that we can share. And it's going to be in Lisbon, so we also very much look forward to being there and make this a pioneer event in terms of healthcare sustainability. So we are very open to getting feedback, to getting your inputs about how this can be done, and between now and October try to find a good program that we can work on together. So I will stop there, but I thank you very much. I've done some talking already, but I also would love to hear from you either now or after I'm done talking, so through the rest of the conference. So thank you very much. I hope you see some use in this initiative, and I look forward to your feedback. Thank you.
Thank you, Sylvia. So we have a quick survey for everyone. So if you have your cell phone with you, you may use this QR code and enter in our survey, and you may answer to some questions we opted to create to try to give some more movement to our session. We have two. Meanwhile, where you are doing this, you can use mentip.com if you want, and then use the code that will appear after the QR code. Meanwhile, we have 3 questions for Sylvia, made by the audience, that I would like to ask you. So, one of them is about the emergency to act and tackle the impact of climate changes. We are always speaking about the positive discrimination measures. The audience would like to know that if you don't think that it is time for heavy sanctionary measures. What do you have to say about this?
That's a good question, and I think everybody realizes those who are aware of the problem want to have very urgent measures being taken, because we know that the impact will take some time to be measured and to take some effect. When we see the numbers, they're not very encouraging either. So it is not our role to be sanctionary. What we want to do is really to promote how we can do things as best as possible, but we do want to also make advocacy to also encourage the states to make the right decisions and to be accountable for their inaction. So for instance, we do have a virtual presence at the COP27 taking place also in a few weeks, where we will be in partnership with other major actors of the healthcare sector and really push the states to take action. So yes, I think there's more than just incentive to share, but also measures that should be a constraint. But also, when thinking of the Paris Agreement in 2015, it was a historical milestone in terms of having, for the first time, an agreement that was binding. And although, well, there's always a limitation, as we know, in terms of politics and the actions that can be taken. But yes. There is urgency.
We have another question from the audience, which is kind of related with the quality assurance of any kind of accreditation or something about sustainability, which is, will the maturity diagnostic tool available, will be the maturity diagnostic tool available for general use of the hospitals? Will the center give any kind of support and guidance to hospitals to address their failures or their lacks?
So thank you very much for this question also, and indeed it's a goal to also be involved in the assessment, the results of each hospital, and to maybe try to do some adjustments according to the results of everybody. So without providing always individual support, but knowing that for someone who would be in such situation or in such country, there are those. It's kind of an open door for other organizations that are also doing some things. And to make sure that you can get connected with people who are in the same situation and are or have been in the same situation and know how to act accordingly. And on our end, we will always be available to provide some adjusted and bespoke trainings, because this is something also, when talking about the trainings, it's not going to be just one formula that applies to everybody, of course, because a lot of policies may be according to the country. There'll be a lot of different things to do. So we really want to make sure that what we provide is relevant. And I think that this maturity diagnostic is going to be this good tool to not be also one formula, but just showing that there's diversity in the types of responses and in the different approaches. And of course, we would love to be available to help if there's a need.
Thank you, Sylvia. I would like to ask the technical team to pass the slide. We have made two questions for you, and this is our answers right now. So, the first question was about what are the first 3 words that come from your mind when you think about sustainable healthcare? So, as you can see, a lot of words, a lot of different words, but 3 words we have in the middle, which is costs, waste, and energy. We had another part of this survey, which was about the ranking of questions. I would like to pass through to the next slide, please. I'm not sure if anyone had the opportunity to do it, but we will leave it. We'll leave it to you to fill the and prioritize the most useful to the least useful ways to improve to get to a better and more sustainable healthcare. And after we will share with you in the social network. I want to thank you, Sylvia. I don't know if she wants to make a final declaration, but I want to thank you for all your sympathy and for all the sharing you allowed us today. And I will finish this session if
No,
Sylvia doesn't
thank you, Leandro. Thank you to the audience in person and also online. And I'm available if you have any question, wish to discuss also potential projects that we can do together. If you have good examples in your hospitals that you also want to share, we would love to gather them. So really feel free to get in touch. You have my contact on the last slide, which I think will be shared. So thank you very much.